Good morning, everyone. It is 10 o'clock, so we can go ahead and get started with today's webinar. Welcome, good morning. Today's webinar will go over findings from the 2021 Youth and Young Adult Tobacco Use Survey. Today's webinar is hosted by California Youth Advocacy Network, or CYAN, and COUGH, which is Campuses Organized and United for Good Health. So a little bit of Zoom housekeeping. I know we've all been used to the Zoom life for the past 15, 16 months, whatever it is. But we do ask that you please remain muted unless invited to speak. We will have some time for Q&As at the end of the webinar, but if you do have questions, feel free to type them in the chat box throughout the presentation, or you can raise your hand. And as always, this webinar is being recorded and the presentation slides will be sent to all participants at the end of the webinar. So a little bit about California Youth Advocacy Network, or CYAN. We are a statewide training and technical assistance provider. We work with all of you on a local level to engage youth in tobacco control work and to change the tobacco use culture among youth, colleges and universities, and other young adult populations. Our three areas in our scope of work include youth, which is to increase and strengthen youth engagement in tobacco control work. We also work with young adults advocating for smoke and tobacco-free college and university campuses. And lastly, we make sure that we're up to date with emerging products so we can educate young people, adult partners, communities about the emerging tobacco and nicotine products, and so we could support quit attempts as well. And we are funded by the California Department of Public Health Tobacco Control Program. Next, I'd like to give a little bit of information about COUGH, which stands for Campuses Organized and United for Good Health. COUGH is a statewide student-led coalition of college and university students throughout California. We do have representation from the CSU, UC, private, and community colleges system. Our COUGH student leaders work closely with CYAN staff on specific projects and in their efforts to promote, establish, and sustain healthier college communities throughout the state through tobacco-free policy, education, and cessation. Next, I'd like to have our presenters speak out to you. I'm excited to introduce our COUGH student leaders who will be doing the bulk of the presentation today. So I will go ahead and hand it off to them.
Good morning, everyone. My name is Brennan Harden, and I'm coming from UC Berkeley, class of 2023. Excited to be sharing this information with you all this morning.
Hi, everyone. Thank you for joining us today. My name is Samantha Skinner. I will be a rising senior at the University of Southern California. Right on.
Hello, everyone. I'm so happy you're all here. I'm definitely excited to share this information, just like my fellow COUGH members. And I am from UC Davis. I'm a transfer student, transferred from Las Positas, but I am a UC Davis student currently, class of 2022.
And we'd also like to introduce Rain from Las Positas College, who cannot be here with us this morning, but contributed to this presentation and to the data that we're going to be reviewing today. Going into the overview, we're going to be covering a couple of different sections today, starting with demographics, then going into a bit of the products that we found in the research, the effects of COVID-19 pandemic on the use of nicotine products, cessation resources and motivation for quitting, and then we'll have a section for Q&A at the end. So first, starting with demographics, we want to share a little bit about the details of the survey from the data that we'll be talking about today comes from. So first, the survey had 59 questions that delved into different aspects of tobacco use, whether or not folks have quit, and different details that we'll review throughout the presentation. We had 423 total respondents, and we administered the survey between March 2nd and March 30th. We used convenient sampling, and all respondents were self-reportive. We used incentives to help get folks to respond to our surveys. And although we do not have a large sample size for data to pull from. The quality, the importance of the data that we got from the survey is qualitative rather than quantitative. So we get to have these great insights into what it looks like for folks that have are ongoing using these tobacco products, have quit during the pandemic, and a number of different perspectives came out of this research. So even though we may not have a fantastically large sample size to predict over a much bigger group of folks, we still are able to pull a lot of important data away from this survey that we conducted. Moving on into some more details, in terms of the age demographics, we saw that a significant amount of our respondents were 18 to 24. They contributed to about 55% of our total group. Our 18 to 24 group are right in the college age students, where we're going to be getting a lot of information, but we also want to show that we got a lot of high school age, teenage age groups. About 31% or 131 respondents were what we would call the high school age youth. So we have a perspective from our college aged folks as well as high school students, which I think it really gives us a great opportunity to delve into how the pandemic has affected each group, and that will be shown throughout the presentation this morning. Moving on to the gender breakdown. We see that we do have a skew a little bit more towards female respondents, which isn't necessarily all that out of the ordinary. Females do outnumber in most institutions in California, students there, but we do see a noticeably larger skew than most universities between the male identifying students and female identifying students that responded to this. So something to keep in mind, that our demographics did skew a little bit more female, but nothing hugely out of the ordinary for something like this. Moving on to race and ethnicity. When we compare this chart to the general demographics of college age and high school age students, we see that it matches generally around what that tends to look like for California high schools, as well as California state universities and University of California's. So this data right here matches quite closely what we would expect to see if we were just collecting the general race ethnicity data from California colleges, for example. So not anything noticeably skewed here, but good to know that we got approximately appropriate responses per each race and ethnicity. Moving into current enrollment status, we see that we did get a great group of students that were in college. About 51% of students in California colleges or universities. We also got a great group of California high school students. Great way to delve into what is the current status of nicotine and tobacco use in California high schools. Next, talking about colleges and universities. Like I said before, this goes a little bit more into depth of the 202 folks that identified themselves as being college students. We see that a majority of them did come from private universities, but we still have a representation from the California State University, UC system, and the California Community College system as well. We would want to consider the impact of the private universities on the amount of data, because it is a little bit interesting, but still the fact that we're able to get the qualitative data from these folks still makes the data incredibly important for us. In terms of year in college, we see a pretty interesting graph here that leans third and second year, but we did get respondents from every year, including graduate students and PhDs, which was interesting and great to see, but nothing major to take away from their necessary year in college. In terms of transfer status, this is an important one to know that we are capturing transfer students. They do pool from an entirely different demographic, and it's important for us to know how transfer students are being impacted during the pandemic and how their nicotine and tobacco use is changing during that time. So it was great to see that we got about 18% of students were transfer students in our respondents. Moving into what products college students are actually using. Moving into tobacco brands, like we said earlier in the presentation, one of our goals at CYAN is to identify the products that are being used right now and emerging products. So this is an important question we asked respondents what kind of tobacco brands are actually using. And of the folks that it said that they were using tobacco in an ongoing way, we identified 50 students that listed the major brands of products that they use first. And what we noticed first and foremost is that disposable products made up about 80% of the total #1 listed tobacco brands that folks had. And that would be your Puff, Hype, and we did include Juul in that statistic. So you can see that those products still are remaining popular even after the policies have been passed against Juul, after changes have been made at FDA against Puff. Knowing that those are still incredibly popular over this past year is important takeaways for us as advocates to know exactly what folks are using, and the fact that they're still getting access to these products despite rules being changed both federally and statewide. I also want to point out the fact that tobacco leaf wraps and Marlboro cigarettes, your traditional tobacco cigarettes, still are being used in our respondents, which is an important takeaway. I think we might find it easy to think that traditional tobacco rolled cigarettes are not being used anymore, but what we can see is that tobacco leaf wraps and Marlboro cigarettes contribute almost 20% of the #1 listed product brand or product type that folks responded here. So that's an important takeaway for us to know that those are still issues among respondents here. Moving on to where are college students getting these products, it's important to know if we can identify what brands are coming out and what brands folks are using. If we know where they're getting them from, we can get a bit of a better idea on how effective certain policies are or what needs to change in the future in order to put an end to these products getting in the hands of these folks. So first, what we noticed is that we asked about how has it been for folks getting their tobacco products, and most folks said that it hasn't been any different or that it's easier. And that's important for us because it shows that there may not be a necessary incentive for folks to quit by it being harder during the pandemic. Some folks did say it was harder, about 10% of folks did say it was harder. But to notice that it's so easy for folks to get it among these 50 respondents is important. A big takeaway from the next question is, where do you get your tobacco products? Almost half of students said that their first place to get their tobacco products were local stores. So the brand names that we reviewed earlier, the Juul, the Hype, the Puff Bar, and Marlboro cigarettes, tobacco leaves, that means that most of those products are coming from in-store, from local stores. And what that tells us is that in California, even though we have certain products banned or limited or policies that have been passed to limit or in some case outlaw certain sales of these products, they're still being distributed through local stores. The friends takeaway is also important, that people are getting it from their friends. Not much that we can do in a policy perspective from there, but also a good takeaway is the fact that folks can and are getting them online. So being able to get these products from other states or from international sources still shows they're able to get their hands on it. Not that difficult. Moving on to our last question, we broke down the data here into trying to find out what are the actual products in the store. So even though we only have 11 people that have identified that they get their products the most from stores, we did find that half of those students, 6 of the 11, put Puff Bar followed by Marlboro and Juul. Both of those were tied. So what that tells us is that out of these 11 respondents, even though it's a small number, it still does reflect more broadly these college age students in these similar demographics, that they still are leaning more towards Puff Bar and these disposable products, but also the fact that Marlboro and Juul was still popular are important takeaways for us to have. I'll pass it on.
Awesome. Well, thank you so much again, Brandon. Just to remind y'all, my name is Samantha, and the focus of my portion of this presentation or this webinar will be on the effects of the COVID-19 pandemic on high school and college age students' tobacco and nicotine product use. But before we get into that, as Brandon stated earlier, the value that we found in this survey really lied within the qualitative data and the responses that students provided to us. A number of the questions on the survey were open-ended responses where students could type in however much they wanted to in order to answer the questions that we posed. And so the bulk of our respondent population stated that they had never smoked, vaped, or used tobacco and nicotine products. That was 239 respondents, so over 50%. And we asked them, why do you choose not to vape, smoke, or use tobacco nicotine products? So a lot of the value within this survey can come from this group of individuals. And obviously it's important to know why students are choosing never to use these products in the first place. And so that's what we're going to take a look at now. So this is a word cloud. In case any of you don't know what that is, it's a collection of words that were taken from respondents' responses that they inputted, and it shows the frequency that word popped up. So in order to generate this word cloud, the 239 responses we received to the question, why have you chosen to never smoke, use, or vape tobacco nicotine products, were inputted into a cloud, and the frequency of the words which popped up is now generated here. So we're seeing phrases like health, bad, and lungs popping up the most. And this is to be expected because a lot of messaging that is generated about, drug use prevention can be found within these terms, but then there's some other interesting things that we can take a look at too. So the goal within tobacco control shouldn't be necessarily to find sustainable and suitable cessation methods. Ideally, there's never anything to quit in the first place. And so messaging on why an individual shouldn't smoke or use these products in the first place is critical. So the campaigns that currently exist to encourage youth not to use these drugs are usually focused on health as a primary motivator, and this is definitely working for a lot of students. But here we're also seeing phrases like smell and chemicals. I see expensive and family. So these are terms that we're seeing crop up with great frequency in people's explanations as to why they've chosen to never use tobacco and nicotine products. And so these are all great places to start when crafting messaging for individuals. And of course, this messaging doesn't have to just apply to those who have never smoked, but can also apply to those who are current smokers. So again, these were 239 respondents, greater than 50%. And so our hope then is that looking at the logic behind these respondents' choices to not engage in tobacco and nicotine products can help to craft messaging for individuals in the future. So moving on now then to the bulk, well, actually first, let's look at some of these individual responses. So I can read these out loud. So I've been surrounded by the smell of these products growing up in my apartment complex. Smelling the secondhand smoke made me feel disgusted. So naturally, I didn't lean toward those products. The smell of cigarettes is triggering and it makes me feel nauseous. This isn't the same as marijuana. So this individual respondent really was focused on smell as their main reason for not using tobacco and nicotine products. Because I didn't have money, again, making these products more expensive makes them less attainable. So obviously finances are a big factor. I learned from school about the harmful effects of nicotine and vape products. This curriculum has been stuck with me since elementary, and I saw there were more cons than pros for smoking. So this individual had education in elementary school, and that has stuck with them, which is something we love to see. I have asthma and I don't like the smell. So again, this combines health and smell. Why would I vape or smoke? It's disgusting. There's really nothing else really to unpack there. And then of course, it's 2021. It's not cute to have a nicotine addiction. So these are all reasons then that college and high school age students responded as to why they have chosen to never smoke, vape, or use tobacco and nicotine products. All right, so now we will get into the effects of the COVID-19 pandemic on college students' tobacco and nicotine use. And this does include high school students. I want to say around 70% of the respondents in this section were college aged. And we will be putting out an infographic with all of the numbers more. Again, this is more focused on the qualitative responses rather than the quantitative responses. But yeah, so that's what we're going to be exploring now. So if we move on to the next slide, this question right here, has the frequency of your tobacco and nicotine use changed since COVID started? Was really the main question that we were asking in this section, and this kind of drove all subsequent questions that we asked students. We wanted to see exactly how the pandemic had changed students' use, and 67 respondents stated that they were current smokers or users of tobacco and nicotine products. And so it's those 67 who are currently using and who engaged with our open-ended questions that we're looking at now. So around 50% of students experienced no change in the frequency of their tobacco and nicotine product use during the pandemic. And so that's not the part that we're focused on. We're focused on the 50% of students who did see fluctuations in their use. So it's around even, where a quarter of them saw an increase or augmentation in use, and a quarter saw a decrease in use. We had more people give us logic for those who use tobacco and nicotine products more. So that's really what we want to engage in, because we want to see the logic behind an increased use in tobacco and nicotine products, since that's what we're trying to curb. So the next graph that you're about to see will be related to the reasons that contributed to habits, to changes in use habits. And this is what's called a tree map diagram. And this shows, similar to a word cloud, the frequency of a response. So students generated their own responses. And from those generated responses, we kind of categorized them into overarching categories where the response fit in. Living at home and more time at home was the #1 reason that contributed to more tobacco and nicotine use for students. This paired with stress, boredom, mental health, limited social gatherings, and not being at school were all common reasons that students put for why they were using tobacco and nicotine products more than they had been prior to the start of the pandemic. So we can see that the shift in a student's environment, as well as their daily habits, certainly contributed to changes in use habits. If we go back a couple slides, we'll see a green graph right here. So how do you view your tobacco and nicotine use? Just bringing that back before we explore that 60% statistic. 40% of our respondents use tobacco and nicotine products every day. So now going back to our 60% number, we'll see that 60% of respondents who saw an increase in the use of tobacco and nicotine products use those products at least once a day. So that's important to note, because we see that there are differences within each individual demographic. So going back up to the previous slide before, we can look at some of the sample responses for people that people provided as to their explanations as to why they were using more often than they had before during the pandemic. So stress, anxiety, I wanted something to help, and people had mentioned vaping, so I caved and tried it and it helped. So this particular respondent had messaging from friends, and they were told that stress and anxiety could be kind of quelled by tobacco and nicotine product use. More money, because I do not spend my allowance on school lunch. This individual particularly said school lunch, but we can probably generalize this to a larger group of people, since especially at the height of the pandemic. A lot of businesses were shut down, and so there was less money to be spent on kind of extracurricular activities, we can say. Bars are closed down, there's no clubs open, sports venues, concert venues, so less money is being spent towards such activities. And in this case, this individual is not spending money on school lunches anymore because they can just eat from home since that's where their classes are. Close friends want to gather, and the only thing to do is vape since no establishments are open to spend time at. So again, this has a direct link to the pandemic because since places are closed where people would normally spend time, they're looking for ways of alternate entertainment, and vaping has become one of those ways. So more being at home and often driving alone, so I could smoke, vape in my car on errands if I wanted, for example. So again, this has to do with social isolation. This individual isn't being exposed to as many people. They're spending more time in their car, driving alone rather than with other people. And this affords them the opportunity to use said products more. And then being at home, drinking more often, and seeing the puff laying there. So this respondent kind of highlights a correlation between drinking and using tobacco nicotine products, which is not something we explored in this study, but it's certainly something, a relationship or a link to be explored in further surveys or studies. Okay, so moving on. Has your access to tobacco nicotine products changed during COVID? So of the 67 respondents who had said that they currently used, smoked, or vaped tobacco nicotine products, 24% stated that it was easier to obtain the products that they were using. Now looking at the specific subset of this sample who stated that they used tobacco nicotine products more, 35% of them said that it was easier for them to obtain those products. So another way to phrase the statistic lies on the next slide, and that is, of the 24% of respondents who identified with having increased their use of tobacco nicotine products since the start of COVID, 69% of these respondents found it easier to obtain tobacco and nicotine products. So this link is fairly easy to extrapolate. The easier it is to access the products, the more likely it is that a student will use them. Obviously, then there is a correlation between access to products and likelihood of use, or rather even frequency of use. And that's kind of what we are seeing here. So when students were able to obtain the products more easily, we saw that there was an increased amount of use in those students. And then finally, we can look at the reasons that contributed to less tobacco and nicotine use. 10 respondents said that there were limited social gatherings. 4 said living at home or being at home more. And then we had personal betterment and health risks to self or others being reasons. So it's notable here to take into account that the reasons that contributed to less tobacco and nicotine use, which is obviously what we're going for, didn't really have anything, or rather didn't have a large part to do with health or improving oneself. It was more related to the pandemic here, where limited social gatherings and living at home or being at home more contributed to less use. So we can see social activities on both ends of the spectrum. For certain individuals, smoking is a social activity that can be done with friends. So the absence of these social activities would lead to a decrease in use. And then for others, smoking is a social activity that is done with friends, and there's only certain friends that people are seeing, or it's just done by oneself. And so that's why we're seeing it on both sides of the spectrum. So it would be interesting then if we could follow up with a survey, really asking people to provide the reasoning or specifics between how a limited social gathering either increased or decreased their use of tobacco and nicotine products depending on previous habits. So that's something to keep in mind. Before I pass it off to Tatiana, just to kind of wrap it up, since the start of the pandemic, a majority of college students' tobacco and nicotine use has either increased or stayed the same. So it's those 75% that we were really interested in honing in on. And the most significant contributing factors included living at home, stress, and boredom. These are all things to target then when crafting cessation methods. And And as most college campuses are either going to be hybrid or fully in person next year, this can ultimately be used to support campuses in opening smoke and tobacco free, and hopefully encourage more California college campuses as well as high school campuses to integrate tobacco treatment and cessation services into their policies. So, all right, all you, Tatiana.
Thank you. Yeah, so as Samantha mentioned, my name is Tatiana, and thank you, Samantha and Brandon, for the overview. In previous sections, as we all heard, we got some great insight on, different product usage as well as usage patterns, right, that have shifted with COVID-19 and other factors, which have been interesting and have kind of helped to bring some patterns to our attention. And so we wanted to continue our research through other survey questions that are going to be kind of more towards cessation efforts, trying to find out more popular patterns that have been used by different respondents and just to represent different communities. So first, one of the points that we wanted to know was, what are the most popular quitting methods? And so this had a sample size of 87. Keep in mind, this sample size does contain students and non-students. And we basically just wanted to hear what are the most common in general or most popular. And so in the next slide, we see the question, summarized question that we asked specifically to get this information. And so what's most notable right off the bat is there's 66% of respondents cited quitting cold turkey as the highest, most popular form of quitting using tobacco and nicotine products. And by cold turkey, it basically just means or infers no resources, basically quitting on your own will, which is pretty notable considering this is a large portion of the sample size that we had for this question. And then the second most notable point from our findings in this question is that 23% cited other, which is pretty vague. We will talk about this a little bit more in the next slide, but and then just quickly pointing out, there were smaller percentages that also had a pretty wide variety of citing other resources as helpful, which can kind of lead to more patterns that, again, we will talk about as we continue into other questions. But if we can move on to the next slide, we will talk specifically about the other question that doesn't, it might be a little vague for some, but so just focusing on just a couple of the sample responses. Of course, we had more, but these kind of capture some general patterns and notes. So the first one would be nicotine-free devices. So this person simply just said nicotine-free devices as a popular form of quitting nicotine and tobacco use. And so this is just noteworthy because keep in mind, nicotine-free devices are not necessarily the same thing as nicotine replacement therapies, which is also another option or response that was given in this result, cited as a different category. And the reason why they are different is because some products are either advertised as being, tobacco-free nicotine products, right? And so we've been seeing some usage of these nicotine-free devices as a way to supplement tobacco products. And so this kind of gives us more information and kind of opens the door to more research on finding out what kind of result that can bring to cessation efforts, considering that they are still nicotine products, right? So just information to keep in mind and also to consider for future research. So the second point or response noted here is move back with parents and don't have access to car or dealers. So this supports just some points that were referenced in previous sections where some parts of the respondents in this survey noted that moving back home with graduation or COVID-19 or et cetera has also kind of changed patterns of usage among respondents, which in this case specifically talks about maybe reduced rates of use. So another notable point. And then third is just went to less social settings. So this kind of builds on the idea that their nicotine tobacco use can be a social activity and kind of starting to kind of build on a pattern of kind of considering the normalization of tobacco and how that contributes to usage, and how we might be able to work as partners to support communities to denormalize tobacco use. So just kind of inferencing from these resources that were pointed out in this question. So moving on to our next section, where we build off of a similar question. So most helpful cessation resources. So first, I would like to kind of point out the differences between this question and the previous topic that we just talked about. So in the previous question, we wanted to just know in general, what is the most popular resources to support quitting efforts? And this question is different because it's asking a more personally, what was most helpful to quit smoking, quit tobacco, nicotine use, if this is applicable to you. And so please note that the sample size is 87, which is exactly the same as the one in the previous question, which makes us think that it's probably a pretty similar sample size. It does still include both students and non-students. So with this in mind, let's go to the next slide where we can see the summary of the question that we gave to get this information. So basically the question asks which resources were the most helpful for quitting. And it specifically, the question kind of asked what was most helpful for you quitting, right? So more personal. And so what's notable about these results in this question is that 35.6% of the respondents listed using no resources. And this is pretty consistent with our previous findings in the last question that cited a large portion of the sample size, noting cold turkey as being a very popular quitting method. However, it's also interesting to point out that in this particular question we're looking at right now, 36.6% is a little under half of the amount of people that reported cold turkey in the last question. The last question had about 60% of people citing cold turkey, kind of inferring the same no resource idea. But keeping in mind that this question has a little under half of people citing no resources, can make us infer that when people cite quitting cold turkey or on their own, right, they may also acknowledge that they did have some support in other resources to contribute to their own decision to quit, right? So that was pretty interesting to note. And the second thing that I'd like to note from our responses in this question is that 31% of respondents reported relying on family and peer support to quit. And this is key as we look to support community members that are ready to consider cessation. Another thing that might be tied into this is we've talked about the social aspect of tobacco and nicotine use. So having that peer and family support where there are settings where the normalization of tobacco use is maybe less prevalent may support cessation resources. So these are just some points that begin to kind of shed light on some patterns that can help us as we continue to support community members who are ready to consider these resources, right? And so the third point that is also notable is that almost 35% reported different forms of cessation resources as being helpful. And so that can be seen in the variety of colors in the different slices in the pie chart that note just a wide variety of resources like quit kits, therapy, nicotine replacement therapies, etc., as being also helpful. So what does this all tell us? Basically, this is telling us that offering therapeutic and counseling services to community members as they consider cessation efforts can still be helpful for some students. But then also it points out that supporting our fellow community members who are ready to consider cessation efforts by, giving family support, peer support, and helping them find these outlets where they can find these methods of support can sometimes prove the most successful for some individuals. Most specifically in this sample size, 31% cited that as most helpful. And so moving on to our next slide, just giving some sample responses. As noted before, a lot of these questions were free response, which is really helpful because it helps us to identify patterns, but also be able to kind of get some additional insight from responses. So the first one says, just citing how they ended up quitting. And it says, I just looked in the mirror and yelled at myself, which is a slightly comical way of just kind of thinking about it, just yelling at yourself in the mirror. But then it also kind of just shows that for some people, just a one-to-one pep talk might work, right? And that's definitely great to consider. But then also, if we look at the second response, it says, just quitting cold turkey and using nicotine-free devices when in smoke-filled social settings. So this second point supports the different conclusions we got in previous questions of quitting cold turkey, but this person also acknowledges social triggers and alternatives like nicotine-free devices that might be used. So it's kind of interesting to see how different people interpret quitting cold turkey, where some people it's maybe a yelling yourself in front of the mirror where it's just one-to-one, or where other people it's building your own self-determination by tapping into other resources. And this gets built into the third response here cited, encouraging friends, tips on quitting, especially out of the box tips like deep breathing to reduce cravings, mostly inner determination that I had to develop over time. So this fourth point notes peer pressures, influences to denormalize the use of tobacco and nicotine products, where peers are helping to find alternatives that are helpful to this particular person. But then also just noting that tapping into these external resources are helping ultimately that self-determination, right? To be able to decide that they are ready to quit using these products. And so finally, the fifth point on this slide, remembering why I wanted, the fourth is noting friends that, didn't smoke and having their support. And then now lastly, just thinking about this person is thinking about their son. So basically kind of noting the family connections that continue to support that family and peer support that can really help cessation efforts. So moving on to our next point. So our previous questions have been kind of alluding to some patterns of different methods, different support resources that have been helpful for people to be able to go carry on and consider cessation efforts. But so for this part of the survey, we wanted to go ahead and kind of develop this a little bit more by trying to find out what are the top motivations that help individuals consider quitting, or that motivate individuals to consider quitting. And so for this sample size, it is slightly smaller to 64 different respondents. However, it does also include students and non-students. So if we move on to the actual question that we use to get this information, so the summary of it is, what may motivate you to quit using tobacco / nicotine products? And so something that I found personally very interesting is that the highest one was health as a top factor, which may not be surprising. Of course, health is a big factor in our lives as we try to, continue our daily activities and just, media representation of this. But also it was notable for me to see that over 51% of respondents noted this, because in working with different levels of, supporting communities through tobacco cessation or just, tobacco education, I had just personally heard of different, comments about, potentially, just the traditional health approach of, tobacco nicotine products are harmful for your lungs or something like that, may have, for some people become a little tired, a little bit like I already know that, and kind of just blocking it off, right? So that was interesting for me to find out that it still is a big motivator, right? Which continues to what it tells us for myself as I try to support other community members and as others try to do so as well, is to consider that these health aspects are still very relevant. We may just have to continue to do research and work together to come up with different ways that to carry this message in a maybe more personalized approach that kind of doesn't necessarily have to be that traditional nicotine equals death or nicotine equals lung deterioration message, right? Where it carries a little bit more of a personal tone. So just another point that is interesting to continue investigating together in future research. So the next point is followed by 14.1%. And 14.1% that is basically saying that nothing will motivate them to quit. And this is also important for us to continue to keep in mind as supporters of communities, where we are trying to empower our communities to be able to come to their own conclusions, their own decisions, right? And that in doing so, we should also continue to keep in mind that we cannot force somebody to consider cessation, and we are here to support those who are ready to consider it, right? So just something important to note from that statistic. And the third top motivation reported in this question, it supports a common theme in previous questions that report family as a critical factor that affects consideration of cessation efforts and the success of these efforts overall. And finally, another interesting point, and maybe not so surprising, is just listing money as another report. Some people just started listing, potentially turning in products and getting either a monetary credit or prizes. So just an interesting point that some respondents listed. But just briefly mentioning some sample responses in our next slide. It basically just supports just common patterns where for this person in particular, this first response, lung health and just staying active was a big appeal for this particular person. And if we look at the second one, it says long-term effects, which is basically, it doesn't give us a lot of information other than just looking into the long term. So to this response, it might motivate and also be helpful for anybody trying to support this person to be able to ask maybe some more questions, right? What do they mean by the long-term effects? What does that look like to them so that we can personalize our message of health outcomes to this person so it's more receptive for them. And the third, fourth, and fifth support, again, the pattern of nicotine tobacco use being a social activity and having friends and family supporting ways to reduce the use of these products. So moving on to our next point, let's see. Can you guys see that? Oh, there we go. Okay, so our next point is campus support. And so our sample size is smaller at 29 respondents, but keep in mind that this sample size may be smaller because it is focusing only on students. So that can have an experience and insight on campus resources. So just a note there, and moving on to our next slide with the question. It gives a summary of the question is, what resources would you like to see your campus offer? So most notably, we notice mental health support and resources as being the top ranking choice in this question, which of course continues to support the critical nature of having these resources on campus to support student success. And note my language there in student success, because although we are talking about cessation efforts and supporting students through that, we not only want to support students who want to consider, cessation efforts and succeeding in them, we want to continue to support students holistically, right? Because we did note that stress factors can be a big factor in using these products. So we want to go ahead and continue to offer these resources on campuses as noted by the interests of respondents. And so the second is adding mental health support and campus resources related options in this question. So basically just adding up all these options that have to do with campus resources, we came up with a grand total of over 75% of participants continue to express interest in campus resources. So although the preferences for resources vary, we have an overwhelming majority of respondents who basically are continuing to say having these resources on campus are helpful. And so another thing that's notable is having over 20% of students saying that they aren't sure of which resources should be offered might be able to have us infer that some students may not be sure the campus is available on their campus, may not have tried them before. So again, plays into having these resources, continuing to promote their existence so that students can be able to be encouraged to try out different resources and find out which ones work and which ones don't work for them. And then also, we have over 13% reporting interest in campus resources. And this can support preferences for getting the we're backtracking. 13% of students who report not having a preference or not wanting to have any campus resources on available. And this is basically can lead us to infer or ask, why is it that some students might prefer outside school resources, right? And it might be because they might prefer friend and family support, as we've noted in different questions. So moving on to our sample responses on this. Again, the first one notes virtual and in-person options. So having these resources in maybe both or maybe a hybrid of settings will be helpful according to this respondent. The second one notes education on campus being helpful, but then also an important note of judgment-free zones. So for people to be able to feel welcome, to be able to share about their experiences without feeling judged or stigmatized over whatever it is that they're dealing with that may be contributing to their tobacco use or their tobacco nicotine use in general. And then the third point notes having mental health, and this person cites seeing stress as a high motivation for smoking, as well as depression, which supports that critical nature of having mental health resources. And then the third one, it says, we don't need to address it directly. As a student, it always comes off as disingenuous when we see posters about how bad vaping is. This needs to be a big push towards getting legit medical source health counseling during these times. So basically with this, it's notable to think about some students finding the traditional vaping is bad or nicotine tobacco is bad message as being disingenuous, and basically kind of focusing in on having these mental health resources that will better support students be able to manage outside factors like stress that may contribute to their usage. And then also just the fact that this person is saying disingenuous, maybe they feel that some approaches aren't being personalized and connected to the audience, right? So that's something that we can work towards as we develop our resources on campuses and in communities in general. And so our next slide, basically, let's summarize what we learned from all this, right? We covered quite a bit of information, but basically, we found out that most students cite quitting cold turkey, right, on their own terms. And so the second point is, although we did find that students cite quitting on their own terms as a main factor, there is still interest in virtual and in-person campus cessation resources, which contributes to support to continue having these resources on campus, particularly centered around mental health. And then because if it helps maybe one student, two students, a handful of students, it's still helping students, it is still useful. And then the third one is, even if we do acknowledge that campus cessation resources continue to be useful for some students, we also need to point out that family and peer support seem to be the most effective among the respondents in this survey. And so we want to go ahead and keep that in mind as we continue to promote messaging on healthy options and continuing to build up these family and peer connections. Because moving into our third point, we want to go ahead and personalize our approaches in a way that is more receptive in what does the person care about as far as health goes that can be helpful. What is something that we can do as a family, as friends, that can help my fellow community member, my fellow family, my fellow friend, to be able to support them in their decision to consider cessation. And so finally, the last point, and most importantly, we should consider and continue to strive to promote judgment-free zones. And so a lot of the topics that we came up with or patterns that were revealed in this survey is that for a lot of people, tobacco use can be social. It could be stress due to stress factors, or it could be for a variety of reasons. A lot of our pie charts that we saw today had a wide variety into different sections. So that just goes to show us that reasonings for people, situations for people vary. So that's why let's go ahead and try to promote these judgment-free zones for people to open up and be able to tell us how we can help them, and for us to be able to engage better with them through this. So that is it for my section. Thank you for listening to our different points from our survey, and we look forward to hearing any questions on them.
Yeah, thank you, everyone. I think I realized I forgot to introduce myself. I'm Andrea Fabella, and I'm a college program coordinator at CYAN. So I have my contact info on this slide in case you have any questions after the webinar. But we do have some questions in the chat. First one is, did you look at this by age in reference to the Tobacco 21 law? Just want to preface this with, this webinar is just a snapshot of the things. We did ask a question. The first question that we asked in the survey was in reference to age, and a little over 60% of respondents were under the age of 21. So we do have ample data on youth use, but I believe this, this was about where we get our tobacco products. Okay, thanks, Eliza. So I will let any of the college or the COF students, if you want to answer this question in reference to the products question, if we looked at that specifically by age, or was that just all respondents?
No, we did not look at it specifically by age. We looked at it by first finding out where total folks get their products from and which products, and then we broke it down based on location. If you're asking, like, if we were trying to find out if anybody was, for example, breaking the law under 21, we did not see any of that. People saying, oh, I'm 19, going to buy in person. That makes sense. I hope that answers your question.
Thanks, Brandon. And then we have the next question is, if we know what percentage of respondents felt they had access to each of the quitting resources that we mentioned. So we didn't ask a question specifically on access to each specific resource that we had listed in the survey, and some of the questions were open-ended. So some of the options presented in the data were provided directly from respondents, but we did have, this wasn't highlighted in the webinar, but we did ask a question about access to various healthcare providers. So if participants had access to their campus health center or their primary care provider, a little bit less than half had access to their primary healthcare provider. And then we had around 40% who had access to their campus health center. The rest of the respondents weren't really sure if they had access or noted that they did not. I think it's important to note that while they might have had access to that, we don't have data on whether they had access to mental health care resources, which is something that we're seeing a lot from the open-ended responses as being a favored method of cessation support. Hope that answers your question, Mary. And then I want to, in the interest of time, we can stay on the webinar if anyone has any lingering questions, but we do have some time for maybe another question or two if anyone wants to use the chat box or unmute themselves so they can ask us directly.
Hello, this is Mary. I just thought I'd chime in and say thank you. That was a helpful answer. And just more broadly, I am concerned about the access of youth and young adults to mental health providers that can support them during cessation. And so I think it's something worth looking into more and investigating, and also how those that are not necessarily students might have access, because I think where we have folks on campus, it's a lot easier to access a mental health provider, and then those that are not either not on a physical campus because they are remote, or maybe just not students, may not have that same access. So I appreciate it. This was great. Lots of great data.
Yeah, and we are, this, like I mentioned earlier, this is just a snapshot of the data that we collected, where we at CYAN are working on a way to disseminate all of the information in a more comprehensive either report or infographics. We're still figuring that out, but this is just a snapshot of the data that we collected. There are a ton of information that we can use. So if you have any specific questions about any of the information we did collect, my information is on this slide right here. So you can feel free to email myself and see what information we can provide to you before any sort of report or infographics are released. Okay, well, it is 11, so in the interest of time, I just wanted to thank everyone for being on this webinar. If you have any questions, you can feel free to hang around, but we just want to say thank you and appreciate you taking time in your morning to